The coronavirus is a part of a family of viruses which are transmitted between people and animals. This strain, dubbed the novel coronavirus, is relatively new, but there's lots of chatter about it. Today we're going to have a chat with an esteemed doctor who is an expert in infectious disease management, Dr. Pate-Robinson, to tell us more. Hi, Dr. Pate-Robinson.
Good morning.
Lovely to meet you.
It is good to meet you.
Great. So we have a lot of questions for you today, especially with the recent confirmed case of the coronavirus here in Jamaica. Tell us, what is this thing? What is this virus?
So coronavirus in general is one of the regular circulating cold and flu viruses. So a lot of people will get a cold with some of the more common strains of coronavirus. But coronaviruses in general tend to be very specific to the host organism. So that means either human or pig or snake or rat or cat. They don't usually jump from one species to another, although that does happen rarely. Now, this new or novel coronavirus, novel because it's never been in humans before, is thought to have originated from bats and caused infection in bats, but somehow got into the human population and is causing infection in humans.
Okay, so tell us how we can be precautious, how we can prevent it from spreading.
So generally, this is an organism that spreads by droplets, and it tends to prefer the respiratory system. So nose, mouth, and the breathing apparatus. So for spread, you're talking about droplets. So if I was to cough, the droplets that leave my mouth when I cough or leave my nose when I sneeze can spread between 1 to 2 meters as they fall to the ground. They don't generally circulate in the air for a prolonged period of time.
Okay.
Sometimes you have smaller droplets that might be caught up in the intake for a recirculation system. So if we are in, for example, in this room, we're in AC, and that's a recirculation system. It's pulling air back in. If that air is not filtered, it may catch some of the droplets and recirculate them. And that is a concern in an enclosed space where you do have that sort of recirculation going on, especially if the system is not properly filtered, which the average commercial system is not. And so those droplets occasionally can travel a little bit further, but in general, the larger droplets will fall to the ground, and for the most part, this is a larger droplet concern. So apart from me coughing close to you, sneezing close to you, then the bigger concerns are touching surfaces or hands that are contaminated within the recent time period. We don't know how long this coronavirus survives on surfaces. There are some coronaviruses that will survive on surfaces for a week or more, and some that will only survive for, say, a few hours to days. So we haven't really determined yet what the survivability in terms of the, say, the maximum survivability on a surface for this virus is. And it may differ depending on the type of surface, whether it survives well or not. But in general, if you haven't been in close contact, the contamination of the surface is not relatively recent, it's not considered an efficient mode of spread, and definitely not the primary way that people are getting this. It's more from close contact, where we're in the same environment and you're getting it from respiratory droplets, or we're shaking hands, or you coughed in your hand, you touched the door handle, I touched the door handle after you, I scratched my face, I touched my eye, I sneezed, and we are just cycling the germs from one person to another. And sometimes you are not sick, but you're spreading it. And that is probably the bigger concern sometimes. You don't have to cough or sneeze to have the virus in your respiratory tract. There are quite a large number of people who catch this virus who are not symptomatic. So they don't have a fever, a cough, a cold, runny nose. They're okay, but they have replication or increasing numbers of the virus in their respiratory tract. So then they can still touch collect and give without there really being any understanding that I'm sick and I'm at risk I'm a risk for other people. That's not always clear, especially if you don't know that you caught it from someone because you're not sick.
So Doc, tell us, is there any need for us to be panicking right now? Because we look at the supermarkets, Lysol is sold out, people are walking around with masks, people are walking around with gloves to protect themselves. Should we be panicking right now?
We should never panic. Isn't that the stock answer? No, we shouldn't panic because panicking means you put your brain on the shelf and you do what everybody else is doing. And we can't afford that.
Right.
So how do I protect myself? I'm going to stop and think, what do I need to do? So I need not to gather germs as much as I can, but I have to touch surfaces. So I may have to touch people, I may have to touch things. So after contact with anyone or anything, then you sanitize or you wash hands as appropriate. And then if you're going to touch food, your face, or anything that can't be washed, wash your hands first and then touch those things so that you know at least you are somewhat protective of yourself and your belongings. If you're going to touch your children, go wash your hands and then touch them, or sanitize and then touch them, so that you're not passing any germs you just collected from somewhere or someone and giving it to them. If you know you've been out on the road and in contact with a lot of people, preferably change at least before you spend time in your home environment with your family and go hug them and all those things. Because, you know, we're not going to not hug our family that we live with. That's not going to happen. And children don't deal with that well. We still need to show them care.
Affection.
But we need to do it safely. If you know that you get sick, quarantine yourself. So if you hopefully have enough space in your house where you can be in one room and everybody else can be in the other rooms, then do that more often than not. Put a mask on if you're going to be in with other people. For anybody, when you're quarantining yourself, preferably have open windows so that you have good air circulation and not just recirculating the same air as much as possible. And so that the air that you're circulating is not then necessarily circulating through the whole house. And when you're using the bathroom and other spaces, just clean up after yourself, wipe down. I mean, you don't have to have Lysol. You can use bleach. A 1 in 10 dilution of bleach is acceptable, and I know bleach is also being sold out by the bucket. But you can use hydrogen peroxide, and in a pinch you can also use the same alcohol. You don't have to have hand sanitizer. You can buy alcohol, whether rubbing alcohol or even white rum, and clean as you go.
In terms of the symptoms, you know that the symptoms are flu-like. At what point, if I have the flu, at what point do I check if it's actually the coronavirus?
So for the average person who actually gets sick, remember that much less than the common. So basically, most people will have no symptoms. Some will have symptoms. Of those who have symptoms, very few will have severe illness that requires a hospital visit, and very few of those will succumb to the illness and die. Now, if you're talking about the symptoms, the first most common thing is fever, and that's usually the first sign. After that, most people may develop a dry cough. It's not usually a cough that produces cold that you have to cough up. And then you can have a variety of other things. So you could have muscle aches and joint aches. You could have shortness of breath. You could have differences in organ function, which may not be obvious on the surface, but maybe after being checked out by a doctor would be identified. Most people, if they get sick, are going to get well within a few days. The things that we've more identified as risk factors are older age, 50s, 60s, 70s, you know, people who have heart disease, lung conditions like rheumatoid lung disease, asthma, people who have other types of immunocompromising situations where their immune system is not fully effective.
Right.
So people with lupus who are on high doses of steroids, maybe people with sickle cell because the immune function is different.
Right.
So you really have to think about your own personal risk factors. If you know that you're in an older age group, you have other illnesses, diabetes even, then you want to take more precautions. The one thing I would add to all of that is in terms of mask usage. So if you're not sick and you're not taking care of somebody who's sick, and you're not going into a situation where you expect to be exposed, a mask is not really recommended because you can't wear it continuously and it maintain its effectiveness. If moisture builds up in the mask, it gets wet, it's no longer effective. And but the outside of the mask is going to be the dirty side. So then if you are wearing a mask all day, it's not going to do anything for you. You're going to contaminate yourself. That's almost automatic. So if you are going to wear a mask to protect yourself, you'd have to be changing it regularly, and you still have to sanitize your hands and do everything else. The point at which the masks become most useful are when you are sick, then you should mask up so that you're not spreading those droplets. And you still need to change it frequently. And then apart from that, to protect others from your germs, then if you're taking care of somebody who's sick, or you're spending a lot of close time with somebody who's sick and either may have it or has been a contact of somebody who had it or is proven to have it, because we have home quarantine, if you're not ill enough to be in hospital but you're sick with symptoms and you may have it, then you need to stay home.
Right.
So if you are quarantined at home and your relatives are taking care of you, they're interacting with you, then they need to mask up.
Great. And I guess the same would apply to gloves in terms of...
Yes, I've recently seen quite a few people wearing gloves all the time.
Yep.
But then you forget the purpose of the gloves. Whether the gloves get dirty or your hands get dirty, the surface is contaminated after interacting with anything. So then if you then touch yourself or touch something else, you're still spreading the contamination the same way. The gloves don't protect you any more than your common sense does. All right.
Thank you, Doc.
No, we're not doing that.